Why is that so important?
Okay, so our arousal template is kind of a map in our head of what we find sexually desirable. And it's really kind of fascinating because these have been studied a lot, and we know that a lot of them are in place. The elements are in place long before a child is even sexual. About age 4, 5, 6, they start to be formed. And one of the great researchers that did work on this at Johns Hopkins, named John Money, actually found that those templates could be really damaged by any kind of sexual abuse, emotional abuse. And that's where they became kind of skewed and irregular. What we know about templates is that as we grow, as we mature, we can add things in. So I can add some kind of particular body type or emotional type or whatever that I might find appealing that I wouldn't have thought of before. And that can be integrated in my template quite easily. The danger with templates and addiction, especially chemsex and sex and porn addiction, is that because of the tolerance involved in those particular addictions, the addict needs more and more and more stimulation because that dopamine wears thin. They need to up the ante. It has to be more taboo or rougher or more outrageous or riskier. And so a lot of times the type of porn, the type of sexual images, the type of fantasies can get pretty dark or pretty twisted or pretty, they can stray very far from the original arousal template that person had before they got into their addictive behavior. And the problem with that is that those elements really sort of stick. It's like once you see something, you can't unsee it. Now, that is a big problem for us. Those, if we think of it as grooves, they're deeply grooved in our brains. So if I have a particular fantasy that I need for orgasm that's pretty kinky, for example, I may get into my addictive behavior, get into recovery, but I can't have an orgasm unless I actually go to that particular fantasy and use it again. And so that is a problem because that keeps the addictive process alive. And so one of the aspects of recovery is learning how to kind of let those fade because we can't really get rid of them, those troublesome fantasies, the troublesome scenarios. I equate it to a path in the woods where if we keep walking down the path, it's going to stay open. If we avoid it, and like we would a bad fantasy that we don't want to keep alive, we're not walking down the path. The fantasy is still there, but it's kind of overgrown, and we kind of forget about it as other things get our attention. So these arousal templates are really critical to understand. Sometimes in sex therapy work, we start to go in there and try to take the try to work with some of the troublesome fantasies if they're really disturbing to someone. That is work that is really tricky. I think someone has to really have a pretty strong recovery because it's very, very triggering to go in and start dealing with those fantasies. And I think it's something that is only done with professional help. And what I've had success with my clients is really learning how to replace attraction with other things. And it may be going back actually to what did you find attractive before you picked up drugs, and really kind of reignite that, or get off and discover something totally new. But I think it's really hard, if not impossible, for an addict, a chemsex addict or a sex and porn addict, to keep touching those particular fantasies, even though they may not be using the drug or acting out. It keeps it alive, and it really keeps them on a slippery slope. I'll just say one more thing about, for the chemsex addicts I see, if, oftentimes their sexual desire goes away for a while with the methamphetamine, and it can go months or even a year without returning. And if somebody goes too long without returning, I always kind of check out, when you masturbate, are you going to those kind of chemsex fantasies in your head? And oftentimes they are, because it's the only thing that will allow them to have an orgasm. Their sexual stimulation point is still so high. So they're inadvertently keeping it alive, even though they have not ingested a drug for 6 months or 9 months. So these arousal templates are important to understand how to respect them and how to manage them, and especially in recovery, that there's some pitfalls there that we really need to be conscious of. But overall, I think it's useful to kind of understand the concept. And I'm a sex therapist. There's a lot of research and uh, questioning about where do these come from. And for a long time, people were trying to make a one-to-one correlation between some kind of the development of a fetish, particular fetish, for example. And it's really hard to do those kind of one-to-one correspondence things. That may be a combination of biology and psychosocial experience and personality, and who knows. But I think we're trying to explain, gee, why does someone have this particular fetish? Can we go back in childhood and see where that came from? And no, you usually can't do that.